A bloke reached out to me a couple of weeks ago. His name's John, and he sent me his details, sent me stuff about me, talked about us collaborating on a podcast. I checked up his stuff, and it's pretty amazing. This guy is different. I was intrigued by what I saw and what I read, and I invited him to come on and just have a conversation, not necessarily an interview. And it turned out to be fascinating. All his details are in the links below, but check out the interview. Love to know what you think. Welcome to Mark My Words. Mark My Words is the story of my journey from a place where I was shattered to where I could live again. I'm excited today. We have the opportunity to have a conversation with somebody that I am very much looking forward to getting to know better. John, I'm not going to try and pronounce your last name, but you are from your listener. John, I'm just grateful that we have the chance to have a chat today, mate.
Thank you, Mark, and likewise, I'm grateful to be speaking to you after all that I've heard that you've achieved.
Oh, okay. You've thrown me a little bit there, but mate, we have kind of connected through each other's podcasts, and we both come from a lived experience background. Do you mind? Can I ask a little bit? You in your bio, you talk a little bit about the fact that you had mental ill health at some stage.
Sure. So over the course of approximately the last 14 years or so, I have had mental illness, and I wouldn't say I'm completely recovered from it. I do experience anxiety, depression, PTSD, and borderline personality disorder. I do also have autism, although that's, even from my psychologist's standpoint, not so much a mental illness as just a difference in the way that I see the world, which is now becoming accepted as the way that autism manifests. It's not inherently a disability or a mental illness. It can simply be a brain type. And it's been a significant journey from thinking that I was just, quote unquote, a moody teenager to uh, learning about the nature of the different illnesses beyond what I'd read in the psychology textbooks, but rather how it actually feels, what the experience is, to now being able to understand it to the extent that I can live completely independently. Not, as I said, I'm not completely recovered, but I'm lucky to be able to say that I do live a completely independent life. And I've been a paraprofessional therapist and social worker before for most of the last 4 years, including my current profession as a life coach, which is within the same vein.
Mm. I've had the experience recently. My daughter has just been diagnosed with some things, and the psychiatrist that we went to, he said something wonderful. He said, I'm not giving you this diagnosis to give you an excuse not to do things. I'm giving you a diagnosis so that your life can be lived to the full, with you being able to deal with these struggles that you have. It's such a wonderful perspective, and I actually hadn't heard a clinician say that. Um, it seems like you've done that. You've taken stock of your mindset, your neurodivergence, if you will, and you don't see it as a hindrance. You just see it as another way of thinking. Would that be a correct statement?
Absolutely, and I'm glad that your daughter's psychiatrist has that mind frame. Not all professionals do, but I'm glad that they certainly do. And it's important for people to understand that diagnosis exists for an important but very specific reason. That when we diagnose, it's so all the knowledge that we've learned about how the mind works and what can potentially go wrong can be brought together to identify what is most likely causing the problem for the individual and what's most likely to help. It shouldn't be to stigmatize, it shouldn't be to make premature judgments, and it shouldn't be for the sake of a label or as a convenient means of referring to that person. It should be to refer to and cross-reference knowledge that we already have about what might be wrong and how to best help. And that's the specific purpose of a diagnosis. So it sounds like your daughter's psychiatrist understands that.
Well, I was really impressed. It actually tied in quite well with I listened to one of your podcasts, and it talked about how just because somebody has a qualification doesn't necessarily make them just because they've got the qualifications doesn't mean that they're particularly proficient.
Yeah, that's true. And one of the topics of which I try to raise people's awareness is cognitive bias and mental shortcuts that we take. And using credentials, for example, particular experience or particular formal qualifications, as a shortcut to recognizing someone's competence is quite common. And it has a practical purpose, I will admit, when you want to perform a specific profession, especially one that requires a lot of specific skill or where there could be danger if you don't practice it properly. You need to learn it in a formal setting to make sure that you're learning everything you need to know. And the people who instruct you are not going to be able to watch every second of your work post qualification to know that you're practicing competently. So you have to demonstrate your skills in assessments, which are essentially simulated work. And so credentials have a place, and they can certainly, when properly used, increase the likelihood that you're going to be competent. But too often, especially in the employment field, we rely on them as a proxy for competence when sometimes it's actually more reasonable to recognize the individual person's attributes and how they can develop skill. In certain social services, I think that's a prime example because I've seen people who come from a non-social services background become fantastic social services workers because they had the dedication to learning. And I've seen some people who are formally qualified and licensed perform some rather obvious mistakes that I consider to be rather obvious to avoid. And in that case, the credentials themselves were not enough to prevent them. So
Mm. Now, in your work, it was very interesting. I listened to the podcast. I heard an educated man. I heard a man that knows his subject matter. I was looking through your website. I was finding out more about you, finding out some of the services that you provide, the way that you go about helping people. It seems to be a very holistic way. But the thing that struck me as well is that lived experience that you have. You don't shy away from that. You were saying about how when you want when you go and see somebody with credentials, they can often put on that veneer of, well, you weren't saying this, but this was my interpretation. They put on a veneer that I've got everything together. You walk into a beautiful office. You've got a nice receptionist. You then walk into a well furnished room, and there's this veneer that I'm a professional and I've got it all together. It's something that you don't shy away from in your story, in saying that, like you said before, I still struggle with this stuff. How important is it to have that lived experience in that professional setting? And that's a massive question that I've just put out to you. I understand.
sure, and I appreciate the compliments, Mark. And I would say lived experience is massively beneficial. I wouldn't say that it's necessary because if we were to exclude people without lived experience, we would probably be also excluding, again, plenty of people who potentially could be fantastic helping professionals. So, lived experience in and of itself is a credential, much like a qualification. And while it helps, it has to be used properly and it has to be paired with the right personal attributes. But I would say that the value of lived experience when it's properly used is that it allows you to understand phenomena such as mental illness that you couldn't understand if you hadn't experienced it. And it's not to say that the quality of the claims that you make depend upon what experience you've had, because you can still make valid claims about something without having personal experience. For example, based on theoretical knowledge, I could describe what it might the experience that a person with schizophrenia might have, but I couldn't describe it as well as the experience of somebody with post-traumatic stress disorder, because I have been diagnosed with that, and I've learned which of my experience constitutes that diagnosis. So I could make analogies, metaphors, and other types of descriptions that I probably wouldn't be able to make if I hadn't have been diagnosed and hadn't had the experiences. So that's where I believe the importance is in the intrinsic understanding allows you to describe and explain the phenomena in a more relatable fashion, but also show the people that you're helping that you understand, which is one of the keys. Being able to share the empathy through understanding is one of the most important elements in building trust with people.
Mm. So you would be an avid believer that just because somebody has lived with schizophrenia or bipolar disorder, it wouldn't exclude them from pursuing a career um, in the kind of the psychology, parapsychology world. It certainly wouldn't exclude them.
I wouldn't say I would exclude them necessarily. No, in fact, I've listened to multiple uh, professors over some time in the course of my learning that have openly had bipolar disorder or schizophrenia, and they've become psychology professors or law professors. And I would say that the most important factor with lived experience is not whether or not you have an illness, because if you have an illness, it doesn't inherently exclude you, but how you manage it and whether you can comfortably work with people knowing that you have your own struggles. And as long as you can manage that and still maintain professionalism, which being professional doesn't mean having to be fake or having to place a veneer over yourself that hides your humanity. It simply means that there are certain standards that you have to meet in the course of your practice because you're practicing in a very specific context. People are paying for your services and they're paying for you to be able to deliver a certain quality. So as long as you can meet that and you can do it ethically and with regard to your own self-care, then I think it's people with mental illnesses should absolutely be able to access these professions as long as they can practice competently, much like any other person.
Mm. And it ties into that kind of that stereotype that I was mentioning, that idea that the only person that can help me is the person with the perfect life, the person that has not, uh, uh, maybe even I'd use words like maybe they have never stumbled, maybe they've never struggled. This idea that they are the only people that are equipped to help somebody else. Uh, in I guess even in a coaching sense, we think, oh, that person has a certain measure of success in a particular field. They'd be a brilliant coach. Um, but then as soon as you say, oh yeah, but once upon a time they did such and such, it's like, oh well, that excludes them. Um, this idea that the people that need to help us have to be perfect. It's a stereotype that I think you and I both seem to rail against.
Absolutely. I would even argue that if somebody was perfect, hypothetically, I don't think they'd be an effective helper because they wouldn't be able to identify the causes of problems because they hadn't experienced any problems of their own. And I would say that, again, the credential of perfection or having one's life in order is much like a qualification. It's a credential, and in and of itself, it's not going to make you competent at the job you choose, in this case, professional helping. Um, it relies upon, even if one does have their life in order completely, hypothetically, you still have to have certain qualities, such as being able to, in a human fashion, identify how people develop problems, and then how you're going to be able to explain how to solve them. Um, I would say you do have to have a certain level of order in your life. You have to be able to regulate your emotions when you're helping someone. You have to be able to think objectively, and so be not not be entirely focused on your own experiences when somebody has a problem that matches one that you've had, be able to, drawing on your own experiences is certainly important, and I certainly do when I'm helping people, but being able to also look to objective evidence and draw on that when proposing solutions or helping people develop solutions, that's that's a manifestation of order that you would need to have in your professional life. But that's that's something that I certainly wouldn't argue that someone has to be perfect, and I would argue that the best helping professionals have their own imperfections and are comfortable admitting that they're human and that they're never going to be perfect.
Mm. I've often said I would never want to go to a dentist that's never had a toothache. Um, if they don't understand a little bit of, they don't have to have had open mouth surgery, but they've certainly got to have had a dentist in there at least once or twice, scraping it away,
Exactly.
just so that they can understand that, hang on, I'm a human person and I'm being vulnerable to you, and that is a responsibility. And it's something that I couldn't agree more with you about that, mate. I want to just discuss. We talked about you being a paraprofessional, and it's kind of, I understand where it's coming from, but I don't like the para part of it. Just in that, some people might see that as going, oh well, he's not qualified, or he's not, um, he's not, well, yeah, qualified. But that couldn't be further from the case. I mean, you are so well educated and you're continuing your education. Why do you still embrace the kind of the paraprofessional social worker therapy kind of title? Why do you embrace that?
Well, thank you, Marco. Again, I appreciate the compliments. To explain why it's important that our listeners understand how certain helping professions work in Australia. Now, this is certainly not legal advice. I would advise anyone who's looking to enter the helping profession to talk to a representative of a professional body or someone who can advise them. But in Australia, there are several types of recognised helping professions. So, psychologists and psychiatrists are government licensed, so you have to hold government recognised accreditations to call yourself a psychologist or a psychiatrist in any way. To use that word, you require a license to do that. Um, to use terms like therapist, psychotherapist, or counsellor, those are not regulated terms. So any person with any qualification or lack thereof can use those terms, and there's no specific law against it. However, there are professional bodies that recognise counsellors and psychotherapists, like the Australian Counselling Association or the Psychotherapy and Counselling Federation of Australia. And anyone who employs a counsellor is going to look for credentials that allow somebody to get to hold that professional membership. And then with social workers, again, as far as I know, social worker is not a protected title by law, but we have the Australian Association of Social Workers, and any organisation hiring a social worker is going to look for membership of that organisation, which requires certain credentials. And I've also talked about this in previous episodes of my own program, where I talk about how sometimes in the helping professions we play semantic games and focus more on what you call someone than what they're actually doing for their clients. Um, Regardless of who you see, whether you're seeing a social worker for counselling, whether you're seeing a counsellor, whether you're seeing a psychologist, if you have a problem that originates in the mind, the person who is sitting across from you is not going to change what the nature of the problem is. The nature of the problem remains the same. What changes is how they help you. Now, when I was working for other organizations and I was working with clients, the work that I did was essentially identical to what the common English definition of a social worker is. You know, a social worker is someone who helps the disadvantaged access services and counselling so that they can live the best life they can. In basic English, that's what a social worker does, and that's what I was doing. In basic English, a counsellor is somebody who helps people to find solutions to problems of the mind or problems in living. That's what I was doing. But because we live in a system in a country where these terms have not necessarily legally protected meanings, but meanings that are recognised. I felt I had an ethical duty to um, demonstrate that while I was working while I was working in ways that are identical to what a social worker or a counselor does, I didn't hold those professional titles. So I just wanted to be, I personally think that what I do qualifies as social work and counseling, but I wanted to also understand that, I have an ethical duty as a professional not to overstate what I've done. So I'm perfectly comfortable saying I do hold a Bachelor of Psychological Sciences, and I have helped people with a range of different illnesses, problems and illnesses. Some people who have maybe more severe mental illnesses who have psychiatric care but also need additional care, or maybe some people who have even found that traditional psychological care wasn't what they needed and they needed an alternative. And of course, I always have an ethical process that ensures that they're in safe hands, like making sure that if they come to trouble, that they know where to call help. But by and large, I respect people's dignity of risk, and I'll. The only reason that I would refuse to service someone is if I genuinely believe that I couldn't help with the problems that they wanted to solve.
I love the integrity in that statement that you've just said.
Thank you.
You often hear that word para something and you think, oh, maybe they're trying to slip something past us. But with you, it's a real statement of integrity, and it speaks to you. Um, and it shows through in, like, it's funny when you listen to somebody else's podcast because you kind of feel like you know them a little bit.
Indeed.
So when you speak to them, it's like you're talking about this thing in a way that has such integrity, but it always comes through in your podcast. I've never once seen you in any of your literature go, I am the answer to all your problems. It's, I may be able to help you. And I love that about what you do. And I just want to talk about, I was flicking through your website last night, and something that I loved is you talk about the services that you can help people with. And I love how you've integrated a bit of coaching into it as well. Um, you look at things that we kind of expect, like psychoeducation, communication skills, mental health support, but you also look at social skills, decision making skills, time management, budgeting, life transitions. You certainly have a very holistic approach to the mental health field, which I really appreciate.
Thank you, Mark. It's these are skills that I've been able to teach people across time, and I find that the skills that relate to what is essentially life engineering, what I might call life engineering, which is how to solve practical problems to achieve desirable outcomes, are something that, because I've done them a lot myself in my personal life, and then I've taken them into my professional life, being able to teach people similar skills, I find that that's something that I wanted to bring to life coaching, because often in the helping professions, we talk about mental problems. So counsellors often talk about mental illness, which it's a serious problem that people will need help with. So it's only rational that if somebody can help you with those problems, then they tell you that they can help you with those problems. But sometimes what people want help with isn't necessarily to do with mental health. It's to do with wanting to refine the skills that many of us take for granted, like how to communicate in certain situations, how to socialize with people when there are challenges present. And again, it doesn't necessarily have to relate to any type of illness that manifests as a social problem. So, for example, it doesn't have to be someone who's autistic who's looking for training in social skills. It can be any person, maybe somebody who's, from a clinical standpoint, mentally well, that just wants to learn how to refine the skills that they have. Sometimes the skills aren't necessarily essential for survival, but they can be useful nonetheless, and people find that they benefit from them. And I certainly find that sometimes learning skills that aren't necessarily absolutely critical to our survival still help us enhance our life, including with regards to the other areas like how to manage time effectively and how to budget. Some people could be completely well in their personal life and be completely well financially, but learning additional skills and knowing how to manage challenges is always useful in case you ever encounter them. But even if you don't encounter the challenges, you can still improve your life in some way. So there's always something you can do that is useful.
And there's always limitations. It's something that I wouldn't necessarily have thought to ever bring up with a psychologist. How do I save money again? How do I um, transition back into the workforce? They're questions that you wouldn't think of taking to a traditional psych or counselor. Um, and I like how you've stated that is you can work in combination with that. I actually really love the concept, mate. I think you're filling a niche that has, I think it's too long been neglected, that basic life skills, because inherently when you have a mental illness, I think you're in crisis, especially when it's not under control through counseling, medication, whatever it is you need. um, how do you bring your life back together from that point of crisis? Yeah, it's amazing, mate, and I'm super glad that somebody's out there filling a niche that I didn't even realize that it was a niche. So I think that speaks to how forward thinking you've been in your work. So congratulations once again, mate.
No, thank you. Sure. I was really fascinated while listening to your own material, Mark, about your own background working in, you mentioned behavioral modification. I understand. I'm curious as to what that entailed because I've been in a similar setting. I was wondering if that was in an institutional setting, working in psychiatric care, or working in daycare or inpatient care.
It was in a few different places. So I worked in a couple of psych wards, but it was mainly working with people with intellectual disability and with acquired brain injury. And it was people that had basically just learned bad habits, and they people were positively reinforcing negative behavior to the point where that negative behavior became the norm. So, for instance, I might have a client who would like a cup of coffee, but that client might be in a group home, might be at the parent's house, it might be in an institution, but it's 2 in the morning and it's not appropriate for that child to have a cup of coffee at 2 in the morning. Maybe they have autism, maybe they have intellectual delay. Um, they don't understand. So what they do is they'll bang the cup maybe, and then I'll get the cup of coffee because they can't make the connection that, hang on, I've got to ask a person to make this cup of coffee for me. They see the coffee as a end in and of itself, so they might bang the cup, and then they're making noise. So the staff member's like, just to quiet them down, I'll give you a coffee. Another day, another person might insist more. They learn to throw the cup. Um, they learn that if I smash the cup, I get what I want. So what we have is these really entrenched behaviors. And I was always part of teams that would come in and try and translate what that behavior was communicating. Because I come from a place where all behavior is communication, be it positive or negative. So it was a necessary job, but it was an incredibly violent job. um, you're trying to teach, you're trying to basically learn the language that somebody is speaking, and you're trying to modify that language without having the communication skills that you and I have. So yeah, I got hit and punched and kicked and
Mm,
um, a bit. Um, and what it tied into is just when I grew up, I felt that a man could take it. A real man can just deal with stuff. So, whereas another employee or colleagues of mine would step back from a client, say, "Oh, I just can't do that." I never understood that. I always thought I have to persevere. I have to be the person that does this, and I was damaging my own mental health through that. So, but to answer your question, it was I worked in people's homes, in group homes, institutions, all across the board.
what you've just given is one of the, if not the best description of what behavioral modification actually entails. Because back when I was working in behavior therapy, um, the descriptions that we were often given of the frameworks that we used in training were, to be honest, quite bureaucratic, and they never spoke to the heart of what it actually was that you were doing. So to anyone listening, that is the best description you could possibly receive, what Mark's just said, of what you can actually, what behavioral modification actually involves. And you're right that it speaks to the nature of it. And one of the misconceptions that so many people have is that PTSD only develops when you've seen an event that is catastrophic in the eyes of entire humanity, like a world war or a major fire or a car crash. Some people would even scoff when uh, somebody says, "I have PTSD from losing a parent." You know, watching my parent die in a house fire, which is something that I saw a story. I saw a story about somebody losing their father in a house fire recently, and um, many people think that you're feigning illness if you have uh, only had what they call relatively minor events happen. And some people mistake it because they think that in an institutional setting, the power is all in the practitioners. You know, they see all the inpatients as being restrained in straitjackets and rubber rooms and being pumped full of medication, you know, teams of 5 strong nurses at a time. That's not how institutions are actually run. And thankfully, over time, they're becoming less abusive. I mean, we still have a way to go, as far as I know, but we're getting better at it. Um, the mistaken thinking that people make is that PTSD and similar illnesses that you develop are a sign of weakness or bad choices. And this is what I always put to people. I say, think about this. If I inject a drug into you, like a sedative, can you control how that affects your brain? Because all it's really doing is the chemicals are reacting with your biology to cause an outcome, in this case, for you to be sedated. Can you choose not to be sedated as a result of those drugs, in spite of them? If that's the case, if I took your brain out of your skull, would you be able to think? Would your heart be able to beat? Everything has a mechanic behind it, like a set of mechanics behind it. And regardless of how much you try, sometimes you can't think your way out of it. So you can't choose how those events affect you. You can make choices to the best of your abilities, but sometimes your choices are limited. Like you would have had to do your job. You had to be exposed to violence on a regular basis because it was part of the job. You can't choose how that affects you.
Mm. And that was probably my biggest issue is I just assumed that it wasn't. I use the analogy of a tooth. Every tooth that we have has enamel around it. But when you chip away at that enamel and you don't take care of that tooth, you don't get cleaning, you don't get fillings. Uh, One day that enamel is just going to break away completely, and you're going to be left with a mess, pain. Uh, uh, well, we've all had tooth
Mm.
problems, but it's not just I've got a sore tooth; they're crippling. Um, and that's what I was doing with my mental health. I was allowing it to be chipped away, and I wasn't doing anything that I should have been doing to maintain my mental health. Um, I just assumed that I had to be a man. I had to keep going through it. And it's interesting you talk about that power imbalance because um, I talk about how where my diagnosis of PTSD came from was from a knife attack.
Oh,
Uh,
geez.
a staff member a staff member had left out the cooking utensils in a place they were supposed to be locked away. He finished cooking with this client, didn't lock any of the utensils away, and then left for the day. And I entered the unit through the security door, and a kid had two of the kitchen knives, and he was coming at
Oh,
me.
jeez.
And the thing about that, the worst thing about that is in my head, all I could think is I cannot leave a mark on this client or I'm going to jail. So I could not defend myself. I couldn't pick up a chair and kind of put it between me and him. Because all that was going through my head is if he gets a bruise on him, I will go to jail. So that whole power imbalance, particularly as a male staff member in institutions, particularly, um, I think it's amazing that you brought up that point that yeah, we assume that the power is with the staff, with the people that are quote unquote in control, but we're so affected by um, duty of care and ensuring that we're being responsible in a male, we're being appropriate, um, having to hold back those natural, impulses. You've got a client that may be crying, and you just want to put a hand on their shoulder and go, it's okay. But as a man in those fields, you're going, oh, is this appropriate? Is a female staff watching me? Can somebody see me? And ensuring my hand is I'm not getting too close. Those kind of things. That whole and we wonder why there's not a lot of men in the care industry anymore.
Yeah. The amount of control that the other person had in that situation, that's a different conversation with a whole different set of variables. But what's undeniable is you have a right to be safe. Now, arguably, what this says about institutions is not just we need more safety procedures, we need better safety procedures. We need to be better prepared. People need to take their duty of care, like remembering to lock away the utensils. We need to understand one small mistake could have spelled somebody's life there. In this case, either of your lives. So it's not a joke. People have to take responsibility, and that's sometimes one of in current disability care we do focus on giving people choice, and that's important because in the past people with disabilities were often assumed not to have choice. In instances where they could where they potentially could make their own choices. So, for example, people with milder intellectual disabilities, people with Down syndrome, very, very seldom are any people with those diagnoses a harm to anyone else. Very,
Oh,
very
absolutely.
seldom. That's a stereotype that needs to be busted. It's very rare. But in instances where there are instances in which the person caring for you is going to know better how to best protect you, and as long as it's not an abusive way of protecting you, you sometimes just have to trust that the staff, the care practitioners know what's in that person's best interest, because you can't, it would be irresponsible to give somebody who has uh, impaired cognition um, to place them in a situation where they could come to harm and say, well, we don't want to take away their choices, because then you're allowing them to come to harm. And there are
Exactly.
non-coercive ways to protect people.
Absolutely. Absolutely. I was actually working with an organization that uh, is a provides disability services, and I had it was kind of a mediation between the staff and the management. They were trying to learn better ways to work together. And I said, okay, well, for the staff in the institution, do you feel like you've got time to go to the toilet? And the management all went, oh, that's ridiculous. That's the stupidest thing in the
Mm.
world. And I said, no, no, hang on. I'll ask the staff members again, do you feel like you have time to go to the toilet? Because I've worked in group homes and stuff, and you don't have the opportunity to go to the toilet at times. Just because you're the one person that's caring for a client that could be potentially at risk, and leaving them alone is the antithesis of what your job is. And they were really stunned when some of their staff members actually had to say, "Yeah, no, I find it difficult to find time to go to the toilet." And when you work out in the real world, in a say the public service or management or something like that, where it can be easy to forget the reality of what those staff members are going through on the ground, and we wonder why we have trouble getting staff, but we also wonder why we have trouble keeping staff. I mean, why would you choose to do a job like that?
Exactly, and that's an important question that you ask. Why does someone choose? I'd like to think that most people enter into these professions because they care and they want to see people who are disadvantaged have a better life. Um, depending on the exact, the exact profession and the credentials required, I have seen people enter into it for the wrong reasons. But I'd like to think they're few and far between. But you're right. It's hard to persuade people because it's it's always going to be a difficult job, regardless of the working conditions. It's difficult by nature, but when uh, there is a disregard for the safety of the staff, then you're just adding fuel to the fire.
John, mate, this has been amazing. I'm very much hoping that you and I will get the opportunity to chat again. Uh, I cannot thank you enough for reaching out and offering to have this conversation. Um, I'm going to look with interest at your future podcasts. It's a resource that I've been using. It's a resource that I've been recommending to other people. Um, I'm just, it sounds weird, but I've just been honored to chat to you today, mate. This has been really great.
Thank you so much, Mark. I'm much obliged to you as well. I'm so glad that there's a real human, authentic voice in the field that's talking about real issues and really talking about what we can do to address them. I wish there were more people doing what you're doing because we really need it. And it's been an honor to have a space here, and I'm looking forward to seeing how you develop as well. And I'm looking forward to what your future episodes hold.
Now, I want to just give one last shout out. Your website, particularly, is yourlistener.wixsite.com. But a better way to find you is through the link tree, which is Your Listener Coaching. But I know that if you just put Your Listener into all your search engines, you'll get the details to your website and all your work. And we'll also put it in the description below. So people will have no problem finding you. And for me, it's just mark my words. If you put that into your search engine, you'll get me. It's Mark with a my is MI and words. John, this has been great, mate. I really, really appreciate you. And please, if you feel in any way the same as I do, I hope we just keep in touch, mate. It's been great to meet you.
Thank you, Mark, and likewise.
Thank you for listening to Mark My Words. I'd like to thank my producer, Meredith Brosnan, and also Torian, Kevin, and Lorraine. And I can't forget the band Adelaide, who allows us to use their song as our theme.